Again, our Meg Terrell reports.
Hertjan Oskam was unable to take a single step after a spinal cord injury left him paralyzed more than a decade ago. But now he can stand up and walk, even over tough terrain, and go upstairs. Technology is turning Oskam's thoughts into actions. Electrodes implanted over his brain collect signals from the region that controls movements. A computer analyzes them to predict how he wants to move, and then messages electrodes implanted in his spinal cord that allow him to make those movements.
I only have to think about the movement and I can.
This is documented in a new scientific paper in the journal Nature. He was the first participant in a clinical trial for the technology, and researchers are hopeful about future possibilities. He says he can walk about 110 yards depending on the day, a little more than a football field. He can also stand without supporting himself with his hands for a few minutes, and is looking forward to gaining even more function. Meg Terrell, CNN, reporting.
I mean, impressive is only putting it mildly. We're joined now by two people directly involved in this medical breakthrough. Guy Courtine is a neuroscientist and spinal cord specialist at the Swiss Federal Institute of Technology in Lausanne. And Dr. Jocelyne Bloch is the neuroscientist and neurosurgeon who implanted the device in Gert-Jan Oskam. I mean, we are all just fascinated by this story. Guy, as we look at this device, which is known as a brain-spine interface, I know you've been working on similar things. This is really building on some of your previous work. The fact that you figured out a way to basically get around the injured section here in his body, and that there were even signs of neurological recovery. Were you expecting it to be quite this effective?
I mean, certainly it has been a very long journey from the rats, the monkeys, to the first test in human, and finally this breakthrough. And we are always hopeful as scientists that it will be effective. But on day one, seeing Gert-Jan being able to think about a movement and see the movement very natural and fluid, I mean, such a reward, of course.
Can you speak, Jocelyne, to why it works and if it can work on many people, or was this a unique situation?
No, I don't think it's a unique situation. He's the first, he's the test pilot, but I'm sure it's going to work in other patients. So it works because his brain is intact, and the part of the spinal cord that is controlling leg movement is also intact. So we could put electrodes above the region of the brain that is controlling leg movement and above the region of the spinal cord that is controlling movements. And we could then link them. So in all the patients who have these intact regions, we could apply the same strategy.
How widespread could this be in terms of how widespread could its usage be, G? How many patients could potentially be impacted?
And we are really at the very beginning, in a sense. Remember the pacemaker 50 years ago, people walking with a rack of stimulator next to them. It's a little bit what you see in the picture currently. But the key is Onward Medical is a company dedicated to miniaturize everything, validate this technology so it can be really used by everyone who need it across the world in the future.
Jocelyne, were you there when he walked for the first time? Did you get to see it?
Yes, I was there, and I was really lucky. And I must say that I did not, when I was there just for the first day when we were pre-programming the stimulator with the brain implant, I thought that he would only execute slight movements at the very beginning, but he was so fast that the very first day we asked him to stand up and to do a few steps, and it worked. And all the team, G was not here, unfortunately, he thought it would happen later. And so we were all in tears.
Wow. I can only imagine. We can see your face light up as you're talking about it as well, and the smile we see on both of your faces. So this right now is really for lower body, as I understand it, not necessarily for someone who may have been paralyzed with something on their upper body, but could it be amended perhaps to help some of those folks?
Mm-hmm. It is certainly a strategy that we want now to apply. In the future, we've obtained the authorization to do it in cervical spinal cord injured patients, quadriplegic, who cannot move the arm. And we would exactly apply the same strategy, brain implants and cervical stimulation in order to improve the hand movement. And we're pretty sure that a bit of improvement of hand movement would be a lot of gain in their future and in their ability to be independent.
We know that Gert-Jan can also walk short distances without the device if he uses crutches. How can that be possible? That seems like a miracle.
And this was a bit the unexpected discovery, that this digital bridge, by linking the brain and the spinal cord with this like really active training, promoted the growth of new nerve connection. So today, Gert-Jan can really have access to muscles that were previously paralyzed for so many years. And we have exposed this mechanism of basically the reorganization of the central nervous system in preclinical models. So it's very exciting because it's not only a system that enables you to walk, it's also a digital repair of the spinal cord.
A digital repair of the spinal cord. It is remarkable. Congratulations to you both. I think you're going to really change so many lives. We appreciate you joining us this morning.
Just hope that Christopher will still be alive to see this. Thank you so much for the invitation.
You're so right. We're thinking of him, of course, today. Thank you both.
Thank you. Have a great day.
This year's graduating class at the